बापरे.
हो, खूप काम चालू
म्हणजे
आहे तिकडे.
वर्धा वर्धा आणि नागपूर आता मुंबई आणि नवी मुंबई सारखीच व्हायची म्हणजे.
बिलकुल.
तसंही 1 तासच डिस्टन्स आहे.
हो, पण मला खूप उशीर झाला, आत्ता आलो मी जस्ट.
वर्धेवरून की
नाही नाही,
बुट्टीबोरीवरून?
बुटीबोरीहून ग, इतकं रश आहे आणि इतकं म्हणजे रस्ता जाम होऊन जातो.
हो हो हो. हम मराठी में शुरू हो गए, समीर सर बोल रहे होंगे मुझे कुछ समझ में नहीं आ रहा
नहीं नहीं,
है.
सर को समझता है.
नहीं, समझ में तो आता है। मेरे 50% पेशेंट मराठी है, थोड़ा थोड़ा आ जाता
सिरियसली?
है। यस, माय एरिया ऑफ प्रैक्टिस हियर इन दी बड़ोड़ा इज डांडिया बाजार। इट्स वन ऑफ दी मराठी एरिया इन वडोदरा।
ओके.
Madam, good evening.
Hi.
Good evening, madam.
Hello. So, Sandeep, I'm a bit tired today. So, if I go after the first case, you take over the expert comments. Hello? Sandeep, could you hear me?
Yes, yes, ma'am. I am there, and Samir sir will do that.
Okay. I'll try to stay, but in case I'm tired.
No problem.
Good evening, ma'am.
Yeah, welcome everybody.
Good evening,
Good
ma'am.
evening, ma'am.
Good evening. Thank you for your beautiful reel. Samir has already made it viral.
Will be
Thank
अभी
you for
करेंगे
the
मैडम,
appreciation, ma'am.
अभी
अभी
करेंगे.
करेंगे मैम.
Good evening, ma'am.
How are you? How is your health?
Okay, I just get fatigued at night. After 9 o'clock, my energy level is gone down.
Take rest, madam.
Yeah.
I know that you won't take, but still.
Yeah.
Madam, good evening, ma'am.
Good
Nice.
evening.
Hello, ma'am. Good
Good
evening.
evening.
Hi.
Nice to see you after Pune trip.
Yes. Long time.
Yeah. How is your health, ma'am?
I'm okay, but after 9 o'clock, I need to sleep. I get tired at night.
Okay, okay.
So I'll try today for the second case. I'll wait for the first case.
And madam, we get energized after seeing you only.
Thank you. Thank you.
Exactly.
Madam, we can start now, right?
Yeah, start.
Yes, Sanjay, over to you.
Dear friends, welcome you all for the Aki LSC webinar series. Today is also the opening day of our Aki week celebration, the theme of which is also life skills. I would request Dr. Kalyani Patra ma'am to release the video which has been made for this occasion. Kalyani ma'am, and kindly tell how we are going to go. There will be a series of online content which ma'am will be sharing. Over to you, ma'am.
Yeah, thank you. I thank Dr. Swati Bhave ma'am and Samir Shah sir for giving me this opportunity to contribute to something which is really important. And Aki has taken life skills in such a way that we are doing so many life skill sessions. And I thought of it as that if we are doing it with something which is storytelling, then we are able to connect with children and teenagers really well. So thought of this universe, which is will be called as life skill guardians. And this small reel, which today we are releasing, is actually the introduction part, how we are going to do it. So this life skill guardian is a concept where there is a book which contains all these life skill guardians. As we all know, there are 10 basic WHO life skills. And each life skill will be represented by each life skill guardian, and that life skill guardian will be like a superhero which through storytelling will connect with children through each reel. So we will be releasing 10 reels each for one life skill. The first will be next coming will be the self awareness, and we have also tried to create a concept like as we all know, cinematic universe like Marvel and all are very trending when it comes to children. They like superheroes. So this life skill guardian universe will have 10 guardians which will be coming to meet us in next 10 reels, and these guardians will be named as per the life skill. Like for example, self awareness is named Miro, that mimics mirror. So I'm not telling much because that is also going to be something really exciting for everybody to wait for. And I thank ma'am again for this opportunity. And it is up to all of you to watch this intro and spread this to all the children. And we are going to release all 10 reels gradually. Every 2 to 3 days, we will be coming up with the next life skill. Thank you, ma'am.
So you're showing it now?
Have you ever wondered why two children facing the same challenge respond so differently?
Why does one child stay calm while another gives up? Why does one make friends easily while another feels left out? Why does one learn from failures while another loses confidence? What makes the difference? We teach our children mathematics, science, language, but what about the skills they need for life? These are called life skills. These are essential abilities that every child can learn and practice. And sometimes the best way to understand a life skill is through a story. Hello, I am Dr. Kalyani. Welcome to the Life Skill Guardians, a storytelling journey inspired by the 10 core life skills that help children grow into confident, compassionate, and resilient individuals. This is the book of Life Skill Guardians. Within these pages, every guardian represents a life skill that every child can learn, not through magic, but through understanding, practice, and everyday choices. Each guardian brings one life skill to life, helping children face real life challenges with understanding, confidence, and resilience. Together, they remind us that life skills aren't superpowers. They are the skills that help children navigate everyday life. Over the coming days, you will meet each of the life skill guardian, one story at a time, because every great journey begins with learning one life skill. Welcome to the Life Skill Guardians. Have you?
Beautiful.
ma'am.
Thank you, Kalyani. That's a wonderful start for the first day of our
Yes.
Aki week. Over to
Thank
you,
you,
Samir
ma'am.
and Sandeep. Yeah.
Great creative thinking. So that first skill was displayed today, ma'am. Awesome. So this idea will help us connect with teens today and probably get our ideas across without being preachy. So great. It's part of the Aki Week celebration. We also be hosting the online quiz for children between 13 to 19 years of age. This will be in the form of a Google form, which Samir sir will be sharing. And we request you all to pass on this form to your local groups, communities, so that more and more teenagers can take part. And this will be culminated with an online quiz event, live quiz event for the top 6 participants. So this would be an exciting thing. And let us see, this quiz will be about life skill questions. So not only they will be solving them, this will be a quiz which also gives them new ideas and learnings. So that is the second part of the quiz which we'll doing today. Coming to today's session, this is the third lecture of our Aki LSC webinar series. And in the first lecture, we had the introduction. In the second lecture, we had case scenarios. We are continuing this, and Dr. Samir Shah will be continuing life skill approach, case scenario based, so that doctors can apply it in their real life, in real practice. Dr. Samir Shah is the not only national coordinator for AKI. He is an expert pediatrician, adolescent health expert. He is contributing to AKI and IIP in various capacities through his knowledge in adolescent medicine, computers, informatics, prevention of child abuse and neglect, and many much more. He has lots of many achievements, but what I can see is the master organizer, a person who coordinates multiple events with multiple people in such a manner that enhances the quality of the program. He brings his unique vision to the session, and today we'll have lots of learning through him and our esteemed panel, whom some sir will be introducing one by one. So I hand over to Dr. Samir Shah sir to continue the proceedings. Shah sir.
So good evening, friends. And before I start the proceeding of our today's panel discussion, I requesting our Executive Director, Dr. Swati Bhave, to give the welcome notes and about our Aki Week celebration.
Thank you, Samir. We are going to complete 19 years of Aki on 18 July. And Samir started this concept of Aki Week when we finished 15 years. So from 15 years to last 5 years, every year we celebrate Aki Week between 18 to 24 with a theme. And this year's theme is going to be life skill education. And Samir, Sandeep, and Prashant are doing a wonderful job. And every day, new things will unfold, and events are taking place all over the country in our various branches. And we'll be posting this also on the website. And at the end, Samir always creates a beautiful compilation video of the whole week, which will also be shared. Over to you, Samir.
Right. So let's move towards our one of the very important topics that about how we can really approach the different day-to-day problem of our own adolescent and ourselves with the help of the very unique concept of the life skill. And for that purpose, we had started this our webinar series, that is the preventive perception of life skill approach for building the resilience in children and adolescents. But here the life skill approach doesn't mean the how we can implement the life skills in the adolescent and the children's life only. It's all about the building the life skill in not only the children but also the all the stakeholders of the children and adolescents life builder. And for that purpose, this uh, series is mainly aim is to promote the life skill education as a preventive and practical approach for addressing the emotional, behavioral, social, and developmental challenges faced by the children and adolescents with the help of our three important aspects of the life skill, that is the head, heart, and hand. With that, we will directly try to keep our objective, that is specifically identify the common adolescent issues, recognize the which life skills are deficient, understanding the stakeholders' role, apply the practical life skill solutions for that thing, and building the resilience and emotional well-being is our ultimate goal, which strengthen the communication and relationship and create a supportive home, school, and community environment. Our series will be mainly focused what the five framework that what we importantly taking, and they are each time almost two a life skill that what we are taking, considering the parents, teacher, young adolescent, and young adults and medical professionals in the mind. Our main focus will be the prevention and early intervention and having a practical solution. We are not at all focusing the intensive psychotherapy, detailed psychiatric management, and clinical treatment protocols. So our main focus will be the identifying the problem and overcome with the help of the life skill based solution. And for today, again, we having a very excellent expert panel along with our expert guide, Dr. Swati Bhave, madam. She doesn't require any introduction, and it's just a short one slide CV of her that will depicting how it's effective. She is the expert guide of this webinar series and had a family guidance center and adolescent wellness at Jagir officer hospital. Seeing is really working for the adolescent, and of course our executive director of the AKI. We are having a good panelists across the India, starting from Dr. Srikrishna sir. He is the professor and HOD in the pediatric at Apollo Institute of Medical Science and Research at Hyderabad, and she is a passionate worker for the working for the adolescent, and he is the one of the master trainer of our sessions that what we had conducted in last March. Second is Dr. Ashok Sadhwani sir. He is the consultant pediatrician and founder of Sadhwani Hospital at Akola, having a 30+ years of the experience in the advancing the childhood through the clinical care, preventive medicine, community outreach, and pediatric education. From Mumbai, we have a Dr. Amruta Shirodkar. She is a consultant pediatrician and adolescent health specialist at Surya Children's Hospital and Guru Nanak Hospital, and of course passionate certified adolescent practitioner and having a good active member of the AKI, doing so many activity at local place. And we having a Dr. Kashmiri Badbade, our developmental pediatrician from Kolhapur, and presently working with the AKI in such a way that that her place she herself is doing so many activities related to AKI. So one common thing or we can say two common things in our panelists. They are the master trained panelists of the Aki advanced training course of the life skill education, and they are passionate Aki volunteers. So let's begin with our first case, that is the I don't know what I want to be, a career confusion and life skill challenge. Why we are discussing this problem? Because the almost 73% of the students choose a wrong educational stream by class 10, and which act as a primary route for the later career confusion. At the same time, almost 90% students report regretting the stream of the career choice within 3 years of making it. 63.4% of the young adult, what they are thinking, having a really wrong high level career decision that is taken improperly. 60% students aspiring the professional career, only 23% of the job actually they are really what they are looking for. What are the factors how they can begin taking their career? Mainly 60% side the parental pressure, 52% driven primarily salary expectation, 45% are influenced by the peers, and 23% making the decision based on the genuine self-esteem. And because of that, we really thinking that we really have to give a good awareness, because all the career guidance are still making on the basis of the old streaming. Now almost 800 plus career paths are available, but still we are looking for the only few branches, that is what we career oriented things. And because of that, ultimately 20 to 40% students experiencing some type of the mental stress, including the anxiety and depression. So with this background, let's start our case discussion of Ria, 16-year-old girl studying in the class 11, brought to the adolescent clinic by her mother because of the declining academic performance and increasing the conflict at the home over the past 3 months. Until the class 10, Ria was a sincere student and almost scoring 89% in the board exam. Influenced by her parents, relatives, and teachers, she chose the science stream, believing that she become the doctor or engineer as per the best career option. Within few months, she began the struggling the physics and chemistry, and now she says that I don't think science is meant for me. Everyone around she knows that what thinking that all are thinking they are know what they have to do, but I don't know. And recent tests she just dropped to around 45 to 50%. She has gradually lost the interest in the study, frequently postponed the assignment, and also stopped the attending her weekend Bharatnatyam class because of the no motivation. She wakes always with a tiredness and missing the school regularly because of the continuous problem related to laziness. Mother feels that she is now too much lazy and sleeping a lot. At home, conversation usually resolve around the study and career, and parents often compare with her cousin and that competitive exam, and argument going on and on. And ultimately, she is thinking that I am disappointing everyone. And there is no history of substance abuse or any bullying, self-harm, chronic medical illness, and learning disability. Her head's assessment mainly related the loving family, but mainly targeted to the academic expectation and frequent continuous communication going on at home. In education-wise, she is in class 11 science, but difficulty to coping with the academic performance now. Having an irregular breakfast and the appetite otherwise normal in eating habits. Actively, previously she was enjoying the Bharatnatyam, but now stopped because of the lack of the motivation. Drug, no much finding, sexuality, and is also not much concerned in this case. Occasionally, she feels like a failure but denied to the suicidal thought. There is no history of the abuse or violence. And with this history, let's discuss our discussion. What is the primary issue she has over With that, I just requesting our first panelist to give the answer. Over to you.
Yeah. Thank you so much, Dr. Samir sir, and a very good evening to all. So we have Ria here, who's a 16-year-old adolescent girl. Now, at first glance, if we see, this appears to be a case of poor academic performance. But the declining marks here are just the presenting complaint. I think what is more important and the real issue here is the emotional distress that is present behind the academic decline. So she was a previously high achieving 16-year-old girl who has struggled after moving into the science stream. Now her choice appears to be, her career choice appears to be driven more due to external expectations than by her own interest or aptitude. Now, as a result, a few things have happened. She has lost her confidence. She's feeling uncertain about her career. And now she's saying that science is not meant for her. So, along with the declining marks and the academic decline, she has developed loss of motivation. There is procrastination. She's delaying things. She's withdrawing herself from activities which were, enjoyable before, like Bharatnatyam, which she used to do. And she is sleeping more. She has school absenteeism. She has frequent conflict with her parents. So, she also feels she is disappointing her family. There is uncertainty about her career, and though she denies having any suicidal thought or self-harm. Then, Samir sir, you showed the heads assessment. So I think the heads assessment here is highlighting nothing but the contributing factors. I think high parental expectations, frequent comparisons with peers, conversations in the house which are, only centered around academics and career. I think there is definite lack of a structured career guidance which should be there, and there are reduced opportunities for recreation. So to sum it up, I think the problem here is a 16-year-old Ria with an academic decline, which has led to an academic stress and in the setting of very high parental expectations. Now, all these psychosocial stressors have led to a lot of emotional and behavioral symptoms in her and causing functional impairment. Also, we see emerging depressive symptoms here, like she has withdrawal and she has little bit of lack of motivation as well. So I think here we have to identify this early and we have to intervene early by using a life skill approach, and we can in fact prevent progression to a more serious mental health disorder here.
Perfect, perfectly described, very well described, madam. And it's a really a great thing that we now focusing that it's a really a career confusion that lead to the major problem of the thinking process, and that lead to the something related to depression. But it can be the intervened as early as possible with the help of the life skill oriented approach. But let's focus which life skills are missing, and for that I requesting the Dr. Kashmiri to just give the focus related to which life skills are missing, and that is the what missing not only into the our girl Ria, but into the all the stakeholders.
Yes. So if we look at the Ria, she for me, she is not a lazy adolescent. It seems that there is a lack of several essential life skills in her, as well as her surrounding, like the parents and the teachers and the school settings. So as we know that she has performed very good in 10th standards, and she has taken the science by not by choice, because it was an influential decision. She has influenced under parents, relatives, and the society, and it wasn't her own choice or wasn't her own interest. So missing life skills I could see in her is first the self awareness. So Ria, I feel that Ria has never asked herself regarding the opportunities, like the whether she likes this subject, or she's really good in that or not, and which subject she gets excited with, or what kind of personality she is, and what kind of career matches her, kinds of. So like, instead of she accepted the science because everyone believes that that is the best option, even we did that 30 years back, and today when she says the science is not meant for me, it reflects the confusion, not the failure. again there is a decision making is involved in this decision making life skill. I feel it is lagging. So choosing a career is the one of the major tasks during the adolescent. So Ria's decision was not truly her own, as we have seen. So she has not gone with the process of gathering the information, looking at the pros and cons of that, considering the different options. So decision making is not about choosing the right answers every time, but about making the decision depends on the taking a choice depends on the understanding of the subject. So that is missing in Ria. Also the critical thinking. So critical thinking, as she had never thought that what are her strengths, like SWOT analysis was not done. Then the science is not the only pathway. She has not given the options to herself. So what she's facing right now is a peer pressure, parental pressure, and unrealistic expectations are going on. Again, there is a missing life skill is a problem solving, because as we have gone through her history, so she's postponing the assignments, skipping the schools. Then she's not going for the Bharatnatyam also, and she has a withdrawal from the social life. So these are all avoidance behavior, not the problem solving behavior. And also there are a lot of stressors in her life, and she's not probably able to cope up with the stress. That is also missing. Like in 11 12th standard is again a stressful years for any child. Then she has a difficulties with the syllabus, parental expectations, constant comparison. She herself is comparing, and her parents are also comparing, and uncertain. She's not that focused about her career. So instead of healthy coping strategies, she develops like tiredness, excessive sleep, absentees, and lack of motivation, as we have seen. And she's not going for her hobby class also. Then again the emotional regulation. I feel that rather than expressing herself that I'm struggling, I need a help, what she says ki, maybe I am disappointing everyone. So that kind of answers from her is like she is having the emotional dysregulation. So she must be anxiety, feeling agitated or anxiety, or like low self esteem, or emotional overload. So she is not able to handle it properly. Then also the effective communication, as we have seen, there is a lot of conflicts in the families. So with the parents, they always on the criticizing mode, and then again when it comes with Ria, she becomes silent or some kind of argument. So altogether it is like the conflicts in their family. So there is no effective communication I could see in them. Then the creative thinking, Ria sees only two options, either to continue science or fail in the class. So like that creative thinking is missing, I thought, in her. Then also at the parents level, if we are thinking about the parents, like lack of empathy is there. There is no effective communication in the family, or shared decision making we have not seen in the family. And emotional regulation, whereas the same in teachers, again the effective communication is lagging, proper career guidance is lagging. Then there is like life skill education is lagging in her, lagging in teacher and school scenarios. Then creative thinking. So all these things are what I feel is missing in Ria's case. And this is not, I feel, the primarily academic problem. She has a life skill gaps in her adolescent age.
Right, to excellently compiling all the stakeholders where the life skills are missing, and it's not a single life skill that is missing. It's a combination of the all life skills that should be she should learn early, but not able to learn during the her early phase, and that's why the all the problems has occurred. So now we understand what are the problem is and what the life skills are missing. So let's understand how we can get a life skill based preventive prescription to the parents and the our student Ria to get out of such type of the problem, and how she can do a proper research for her own problem. Over to Dr. Srikrishna sir.
Okay. Very good evening to all. The case which you have projected at Samir is very commonly seen nowadays. Somehow I used to think that how we missed previously, because it's very common that many students are forcibly taking either medical or engineering preparation side in the class 11th class, and that is making them to go into some sort of confusion status. Now, let us see how our life skill based preventive prescription can be given for such children. Here, first, we'll see one is self awareness, which is an important life skill, where we have to ask for Ria that let her identify, let her do the SWOT analysis. That's what are the strengths and what is their weakness, obstacles, and even the what is the threats. Here, let her know what are the strengths of this child. Actually, this girl is very good, was very good till 10th class. Once she entered into the 11th class, then she feels that she is not all that good, and her weakness are the one or two subjects here, and her main obstacle is a lack of interest and not able to prepare her mind to adjust for these subjects. That is a main obstacle. Her mental mind feeling itself is that. Of course, we can't blame her, because when she is not having that much, getting that much interest, it is not, we can't blame that she should get completely that weakness. And the one more is what are personal abilities beyond academic marks. What she's already used to go to Bharatanatyam and others with good activities. Now she's stopped going for it. And actually, these activities, other than academics, definitely give big mental relief and increase the positivity in the mind. And again, it will cause a rejuvenation of her mind. And two options can be given to change her mind. Actually, whenever we come across, only there are two options. Should she stop going to this particular field, or that means going back, or should she continue? If she is continue, she has to adjust her mind. That's a good resilience is very important for her, which she need to understand that, and one side positively, because already she has joined, so we can't say that go back unless it is compulsion. So what activities make you feel confident and energized? These things we need to ask the child, and let her tell what is the things. Sometimes they think that what is their achievements, what were their achievements in the past, and even non-academic achievements, that will give really a good energy for them. Now let us see the decision making. Here, teach the structured decision making model, like explore the different career option. But this is a possibly here, when we are talking about this physics and chemistry, when she whether she need to go back and change the subjects is a big thing. Obviously, the parents also will get worried, and that gives really stress to the child. But finally, it is a child mental readiness that is more important. So definitely we should give priority to her, and match the careers with interest and abilities. Like already yeah, that Samir mentioned previously, that more than 70% are not having any clarity about what they are going to do, even at the after 10th class. That means, so at least now at this stage we can give that what are the careers of her interests and what is her abilities, and we need to discuss the advantages and challenges of what are her options. If she's continuing same thing, what are the challenges and advantages, and if she is discontinuing, what are the things. So make an informed decision rather than a pressured choice. That means, because these people actually, it is like everyone keep telling that universally everyone feel that medical degree is excellent, engineering degree is excellent, so they are under that influence that whether to say no or yes. So we should see that she is taking the decision under without much pressure. Now, critical thinking help the challenge the common myths that mainly success is not limited to medicine or engineering. This is very important, because right from the 5th class onwards, if any student is very good at in their marks, Immediately the teachers also start telling and the parents also start telling that this is medicine and engineering. If you see that when we were students, of course I accept that medicine and engineering were the only options, or to some extent some bank jobs. But now if you see that there are many other multiple options are available now, and sometimes the earning and name satisfaction is more with other fields than this particular thing. Similarly, every stream offers a meaningful career opportunities. That is very, very important, provided that she need to have a good interest. That means if you have interest and in the work what you are doing, you can do wonders. This is the what she has to understand, and personal aptitude predicts long-term success better than the social expectation. That means the child need to think that her satisfaction, her own success is much more important than what others expectation. Now let us see the problem solving here. The break the issue into manageable steps, improve the current academic performance. Here the problem is already some might be 3 months to 6 months are over, and is it correct to go back and start new studies? So this dilemma will be there even for the child also, because she is comparing with her own classmates. So obviously whether she can continue in this. So let her improve her academic performance, explore the if that is not possible, she need to explore the alternate careers. And in this regard, it is if she want to go for other career, then it is better at least this time she need to approach a career counselor. And here most of the times we feel that only after 10 years or 15 years or 20 years what we are going to be. But truly speaking, what is more important, first initially when the child is in such state, let it be a short term achievable goals that enhance the confidence in the child. So then she will move on further. And regarding the coping with the stress, of course we need to encourage her more for to go to continue her other activities. In fact, in my personal clinic also, I keep telling to the patients that always have one outdoor activity, one indoor activity like small games or puzzles, or along with one good fine art. These are going to be really mind peaceful, and also they encourage us to go and to work to improve our efficiency in the works also. So these are always very, very useful. And we know the practice how to practice the relaxation techniques. And and especially this particular child is not having proper sleep also, and physical activity also. These physical activity, regular good sleeping habits and good food habits always makes difference. And learn healthy ways to manage examination stress, as our life skill series are having all these, how to cope up, how to manage this examination stress also. Now let us see what the parents has to do. First of all, parents should think that child interest is much more important than their personal issue. Because here many times we have seen the parents that whatever they could not achieve in their childhood, they want to impose that to the child, whether the child is liking it or not. So they should not impose their personal wishes or choices over the children. And the second point here in this is never compare with other children. Not we can tell the parents that not every doctor is an excellent in his career, not every engineer is excellent in his career. Then why they should compare that their with colleague children and undermine this particular child? So it is better not to impose their personal wish over the child. Let the child takes the without any stress, let her take her own decision. So they should replace criticism with curiosity, and instead of why are you wasting your future, it's a type of questions. It is better let them tell about, help us understand what what you are finding it difficult. And effective communication is always better. Actually, their family time. This is very, very important. Now everyone is talking about it. At least daily, if not daily, at least weekly, some time should be given by the parents and other family members to discuss with the child freely so that she can come out from this sort of depression and support the exploration rather than imposing our careers and always recognize multiple pathways to success. Success means whatever field you choose, you should come up with with your excellency, not that whatever the field the parents feel is correct. So when parents understand this, then the problem is solved most of the times. And for the teachers also, introduce the career guidance. This is what actually it's an excellent point is from 6th 7th onwards, let the teachers expose their children for this career guidance from 7th and 8th class onwards. And they can organize the attitude and interest assessment, and that tells that whether the child is having more of business mind or more of medical or more of scientific or more of engineering. These are always very, very useful, and encourage the mentorship by professionals from diverse careers. Actually, in our places now they are doing that, bringing the children to the hospital, and so that let them see the hospital. If they like, in future they will take up the 7th class, 8th class, 9th class children are visiting hospitals or some industries also. That is always very, very useful. And much more important, what our aim is that to integrate life skill education at school curriculum itself, right from the child of 11 years age onwards, which is going to be very, very useful. And both parents will be comfortable with the child, and the child also comfortable with her career and with the family.
Right. So have you had really excellently covered all the stakeholders, really good precision what you had given. And today just the NEET exams result release. So this is a right time to discuss all these things. So our choice of the selection of this topic is really worth because the so many children are really looking after the which choice of the this career will be there, and in few places it will be definitely the what they want they can achieve, but few may not be. So your precision will be really help them to understand what is the role and responsibility not only of the adolescent but of course the parent, how to support them and how to improve their decision making. But we all know this is the not just a simple solution, because few cases are something that will really require a proper intervention. By requesting the Dr. Sadhwani sir, when we can do the early refer or the appropriate refer of such cases, so we cannot miss the bus.
Thank you. Thank you very much, sir. Sir, we have seen the case of Priya, and we have done her assessment. We have seen the missing life skills. We generated the preventive prescription from incorporating the life skills in Ria's life. But we should be very alert after incorporating life skills, that if we see some red flag sign after educating her with life skills, her parents, her teacher, or herself, if we see some red flag signs, so we should not delay to refer her. But as we have seen the case of Ria, it is not looking very hard. Like she was very good till 10th standard, and she was good in Bharatnatyam and drawing also. So first of all, I will tell you what red flag signs we'll consider for referring her to some expert. So first red flag sign, if you see that if she is having persistent low mood for more than 2 weeks, affecting her daily functioning. Like we are seeing that her mood is affected, and she is skipping her school, and she has skipped her Bharatnatyam classes also. Like this is indicating that she has developing low mood. Fortunately, there are no suicidal thoughts or self-harm. There is no drug abuse till now. That is good thing. But there is school refusal and significant absenteeism is there. So when we say it is significant absenteeism, if she has remained absent for 10% of her school days, then it is significant absenteeism. And if she is developing severe anxiety or depression, like she's giving school, I think she must be getting problem with her sleep. So disturbed sleep might be disturbing her next day functioning, and she's remaining tired. So definitely she is remaining anxious and slightly depressed. And next red flag sign, if we think that, uh, does she need a formal psychometric or aptitude assessment? So we'll discuss why this is needed in any adolescent. With this psychometric or aptitude assessment, we can assess some adolescents' natural or inherited strength and problem solving skill. It will help match student with right career paths, prevent costly educational mistakes, and ensure they feel confident in their choice rather than overwhelmed. And the next this sign that can say us that we should refer her if there is ongoing family conflict in spite of giving life skills. Like if we see that Ria and family have got stuck in repetitive unresolved arguments and fights that has led to negative relationship pattern, then family counseling should be done. And next red flag, we should consider that if we have some diagnostic uncertainty or suspicion of some mental health disorder. Although Ria was very good in academics till standard 10, we can think about the possibility of some mental health disorder like ADHD. ADHD, if in early years of childhood, we see that it is external. Mostly the child is hyperactive and but in adolescent, if ADHD occurs, it will be some internal. Means there is overcrowding of mental thoughts. So we can again think of that ADHD also. Dyslexia, I do not think it is there in case of Ria because she was very good till now. And we should think of some major depressive disorders or generalized anxiety disorders or social anxiety also.
Right, sir. So you just clearly mentioned that if such type of the problem that occurs, like the persistent low mood, persistent depression, persistent anxiety, that will be not solved in the when we are discussing with her or the when we are treating her with the life skill based solution, and she is not much interest to that. We have to timely refer rather than to preventive giving the time that. But timely referral is very important. So before we conclude the case, we have a really expert guide, Dr. Swati Bhave madam is here, and she has a tremendous experience of such type of the cases to deal with on the regular basis. So I really requesting her to give the insight and thoughtful things that what really we really require to give the counseling not only to adolescents but a whole family and the whole community on basis of her experience. Madam, over to you.
Thank you, Samir. I will not repeat the excellent comments which have already been made by the panelists. So I'll just add my comments. One thing I would like to add to Ashok, that this child certainly does not have severe depression or she does not have any flag signs of suicide or self-harm. At the same time, she certainly has depression because withdrawal from her routine activities, loss of interest in activities which she previously enjoyed, like Bharatanatyam and music, school absenteeism, not feeling like going to school, having this. So she certainly has depression. And we have to now very carefully watch that after giving the life skill education, can she overcome this depression on her with this? But if she does not overcome, then if the mood is lasting for 6 weeks or more, we have to refer her to a mental health professional. As pediatricians, we also can give anti-anxiety and antidepressant medications, but only those who have got experience and those who are okay giving the antidepressants. Otherwise, it is better to have a health professional. So this girl the very fact that she certainly has signs of depression is a patient whom we should be carefully watching. And we must also talk to the parents and also look for flag signs, because right now she does not have suicidal depression is very good. But at any time she may get these flag signs and we have to be alert. So that's all I wanted to add about the referral. Now, as Samir said, I just want to give some tips to parents, teachers, and everybody in the community. Why does a child get into career confusion? One reason is that the parents may not be educated enough and not are able to tell the child what the child needs. And in such cases, aptitude testing, which is done by professionals, may be of great help. But generally, that is done around 6 to 8 standard, not earlier. And very educated parents who are already in excellent profession, like an IIT graduate or a techie or a doctor, very often have very high ambitions for their children, either to continue their legacy of their nursing home or hospital or whatever firms they have. And such parents pressurize the child into following their career. And this is the worst thing to happen to a child, because if a child takes the parents as a role model, for example, the father or mother are doctors, and the child feels that this is what I want to become. I want to become a doctor like my parents. He automatically will take interest into that subject and he will go into it. But just because the parents want him to become a doctor and he has seen their life and he does not like that life, he automatically thinks, I don't want to become a doctor. And like my both children said, we will be anything but a doctor and IS officer. And we said, fine, you can choose whatever career you want, because they had seen the plus and minuses of both the careers and they did not want it. So when my son said that we are not even going to take the biology subject, it's a burden on us, we'll only take maths, we didn't force them, keep your options open. We said, fine, just do the maths. Very often parents say, take the science stream. You can always leave it and take commerce or arts if you can't cope up. So very often the child is told, okay, you have an option to go to the arts or commerce, making it demeaning like a B grade. That science is A grade, so you must try that first. And if you don't succeed, then as a failure, you go to commerce and science. We have to change our mindset. As Dr. Srikrishna said, today we have more than 800 career options. And we have to expose our child to all the career options. And what is more important is not what degree you get, what job you get, but making every adolescent capable, whether boy or girl, standing on their own feet and being financially able to sustain themselves and their family in future. So no job is demeaning, no career is less meaning. In fact, today, the jobs which we white collar people thought were of low category, like choreographing, DJ, VJ, chefs, they are earning far more than doctors also. So what we have to understand, that we should encourage the talent of your child, the aspirations of your child, but he must be told that you have to have a career which will support you financially, because we can't be there forever. And very often what happens, a child has a certain talent. That I used to get a child who in the 9th standard got a video making competition prize. He immediately told his parents, Ki, now I'm going to be a video maker and I'm not even going to appear for my 10th, because this is what I want in life. So when the parents brought, I explained to him, this is a good hobby, but if you want to go in for video making, you need a degree, because otherwise your competence will not be accepted in the job market. You'll be only 9th standard pass. So you become an excellent video maker, but you have to choose the right course. So we have to encourage that if he's a cricketer, everybody can't be Sachin Tendulkar and earn that much money. So what is a hobby, what is a talent, and what is a career which will make him financially independent is something the parents, teachers, and the child has to discuss. And when you say career confusion and decision making, what happens is that we don't allow our children decision making skills from childhood. We are overprotective. For example, I started with my kids when they were just 3 years old. I used to ask them every evening, what would you like for breakfast tomorrow in your lunchbox? I can make a idli, I can make an omelette, I can make a sandwich. What would you like? This was a very simple thing for them to understand that they can make a decision. And then gradually as they grew up, I started making a weekly plan. What would you like in your dabba, lunchbox? Similarly, even when a child is 3 years old and you're going out, you can keep 2 dresses or 2 shoes in front of him and say, Beta, what would you like to wear? So we should encourage decision-making capacity from a very, very young age for very, very small things. So the child develops the decision-making capacity. if you're buying a TV, you're buying a car, involve them in decision making, because once they become skilled in decision making, then the same skill can be applied for their career. And as Srikrishna said, that if you want them to choose a certain profession, then you say, please go and to the office. For example, you feel your child should be CA. You should find a friend who's a CA where he can go to the office. If you want a lawyer, find a friend where you can go and attend court. Because unless they see the practical aspect of the career, they are not going to understand whether they want that career or not. But very often, unfortunately, parents want to fulfill their unfulfilled ambitions through their children. मैं डॉक्टर नहीं बन सका लेकिन मैं मेरे बच्चों को बनाऊंगा, मैं ये नहीं कर सका तो मैं मेरे बच्चों को करूंगा. Children are born to us, but they are not our property, and we have to allow the child to grow as he is. And if the child takes the career which you like, that is fine. But if the child takes a career which you do not like, you cannot be forcing him into career. I get so many students who in the second or third year of engineering and medical want to give up their career. And after amount of donation and time the parents have spent, and he's halfway through his career, it becomes a big financial, economical, and emotional issue. So I think we have to start teaching children right from the beginning. You can always ask even a 5-year-old child, what do you like? What do you like to become? Of course, it keeps changing. At 5 years, he may want to become a firefighter. He may want to become a clown. At 10 years, things will change. But at least we are encouraging the child to think that he has to be something when he grows up. And that is what we have to encourage. And forcing children to take a particular career, especially happens when a child says, I don't know. 80% of children, if they ask, what do you want to become? I don't know. So these are the children who have to be helped to understand that if they don't know, give them enough information, enough knowledge, enough avenues, so that I don't know will come into some rational thinking, ki, yes, I think I like this. But if the child says, I don't know, parent take over the decision, कि अच्छा तेरे को पता नहीं है ना तो फिर हम जो बोलते हैं तुम करो. So you have to make the child understand. If he says, I don't know, help him to come out to understand that he should. Thank you.
So, madam, excellently, you just compiled the things of your whole this much years of the experience in a very short period of the time. So, before we conclude the case, I just having some thing that what the take home message what we had put with the help of the discussion what is till now regarding the our career confusion. It is not just a lack of the intelligence, but it's open a lack of the self-awareness and decision-making skill. And for that, we have to train our children from the beginning of their career, what the around 6 or 8 standard, what that madam has said. By nurturing the life skill in the early, we empower the adolescent to make the informed career choice, and that reduce the family conflict. It also improve the emotional well-being and build the confidence for the lifelong success. And for that, our preventive prescription will be career decision should guided by the self-awareness, aptitude, interest, and value, not by the just social pressure and comparison. And for the teacher and the career life skill before the career choice is very, very important if we teach them. And it will be beginning as the early career of the standard 8 rather than the standard 10 or onward when the decision making period has started, and then the confusion begins with a conflict, and that's what we don't want. So with this, the considering the our time constraint, we can open this forum for the discussion related to this case only, and our next case we can, madam, if you permit, we will take on the next episode rather than taking
Sure.
in the hurriedly.
I agree. Let us consider on this completely, and we can take the case next time.
Right. So now floor is open for the questions. If anybody has their question, definitely you can ask directly by the unmuting yourself, or you can directly put into the chat box. Madam, till the people can ask the question, my one most important query regarding the today we having a neat result, and now the career choices are going to open with the limited seats of the medical. Few may like to go to the different places, few may not be like to the different places. Few may have to choose other than the medical professionals. So how you give some useful tips for the such student of the 12th standard so they can help them to choose that properly?
First thing, prophylaxis. That means whenever your child is applying for JEE or NEET, you don't make it a life or death phenomena. Like you don't say you have to pass NEET, you have to pass JEE, because if they don't, they feel their failure in life. We also have to give them a second option of career. In the sense that if we say, even if you pass NEET, even if you pass JEE, suppose you do not get the college of your choice and you don't feel like going there, or we are also not very happy to send you to that college, you have to have a second option. We never keep a option two. We always go to that option, and if that option doesn't happen, then you're totally at a loss and you get a sense of failure. So we have to consider, and now I'm getting a lot of people who are coming to me with these competitive results. For example, I've got a patient who will be staying in Pune, and if the child has to go in a very extreme north or extreme south, where the language is different, culture is different, the connectivity not being there, and especially if it's a girl, they naturally worry ki, should I send my daughter so long, 5 years away? And this is a big question for the parents ki, can we send our children away from home to another very far off medical college, or should I let the medical college career go? Now, this is a case to case based question. You can't give a hard and fast rule. There may be some children who are quite okay and quite strong staying away from the parents at a distance in the hostel, and they may do quite well. There are some children who are not so strong, who come under negative peer pressure, and who may not be able to continue at the age of 17 going to another far off medical college without parental support, etc. So, just because he's got admission, you don't have to push the child into a medical college or engineering college if the child is afraid of going there, or if the child feels I may not be able to cope up. And that's why we have to always have the second option open. So then he gets the college of his choice, there's no problem. The family is happy, the child is happy, everything is hunky dory. But if the child is not getting a college of his choice, if the parents are worried about sending him away, we have adolescent experts like in this panel. I would suggest to the parents, bring them to an adolescent expert and talk with them so that they will guide you. They will assess the personality of the child. They will assess whether this child is capable of going this place. Because remember in Kota, everybody sends their children for those Kota wonderful classes. How many of the children are able to cope up in Kota? And they have the highest suicide rates in the country. So just because you have got an opportunity doesn't mean you push your child into it. It's good that he got an opportunity, but medicine is a hard course. If it's 5 years plus 3 years post graduation, and that also if he passes at every attempt. So we are thinking 10 years down the line. So you have to consider that yes, he passed NEET, तुमने फोर्स किया, मोटिवेट किया, जो कुछ है रिजल्ट मिल गया, लेकिन आर यू रियली गोइंग टू हैव दिस चाइल्ड गो थ्रू दीज 10 years? एंड इट इज वर्थ अगेन डिस्कसिंग विद द चाइल्ड, अगेन टेकिंग प्रोफेशनल ओपिनियन कि जाना है कि नहीं है. नहीं, अभी नीट का एग्जाम आ गया, रिजल्ट तो अभी जाना ही है. दैट इज नॉट द थिंग. यू हैव टू स्टिल असेस, इज दिस चाइल्ड हैप्पी, capable of wanting to be a doctor, and with 10 years of his life spent in medicine. And today, with the violence against doctors, many people are not happy being doctors. So we have to consider that also. And you see, by the time a person becomes MS or MD, you take the other specialties, they're already earning. They're married. They may be having a child also. So for a doctor, you are starting very, very late. So you have to make the child also aware that this is the path of 10 years. Are you ready for this? He's only 17. He has just passed his NEET. He's now thinking, abhi pass ho gaya to jana hi hai. So we have to think this very carefully.
And what my personal thought of any examination, it's all any exam is considered as a SWOT analysis of that type. And it is just type of the one staircase ladder, and that we have to take the decision steps to be taken on the which side and how, and that's what we have to teach our student also, and the parents also have to understand. This is not just the end of the anything, it will be just starting of the new beginning. That's what really we have to convey the message. Now the one hand is raised. Yes, Pooja Cheda, you can ask your question.
Hello, good evening to all. Thank you very much for this beautiful session. It was very insightful. I had a question where mainly, like I had one client who had come where she always had a comparison done with her siblings. And now, when she has three kids, she has also started comparing as to how my kids are going to be in the academics and all. Plus, there's a lot of peer pressure which is there. So, in that case, how do we go about taking care in such situations
You
where
know,
the
yeah.
confusion happen, ma'am?
Yeah, see, Pooja, we all do our parenting based on the parenting which we received because that is what has been our role model. So, if this girl is used to such comparisons, we have to first change her mindset. She requires first counseling, how to deal with her children and how to help her children. So, we'll have to counsel the mother also and we have to counsel the child also side by side.
Okay. So, ma'am, would this take a long time for the clarity of the mother also? I mean, because it's been so many years where she has been in that kind of a state of comparison, and plus now it's not only just being to academics, but even in general overall scenario, also the comparison has started with the kids.
See, I'll tell you one thing, all of you who are counselors know that unless a person is motivated to change and unless such a person does introspection and understands that these are my negativities and I have to overcome them, any amount of counseling is not going to change that person. So, how soon we'll get the results will totally depend on that person's mindset. So, first, when I take cases, I first then, are you accepting that what you are doing, this constant comparison, is harming your children? And are you accepting that you need to change? Then I can help and guide you. And if that person says, yes, I realize that that comparison hurt me as a child, and I'm following the same negative pattern, and I'm now hurting my children with this comparison, and I want to change. Because unless they come to the stage of introspection and acceptance they need to change, it is very difficult to change them. But once they have come with that, I think in 1 or 2 sessions, I have changed people because they are understanding, motivated, wanting to change. So even 2 sessions are good enough. But if not, even 10 sessions are water down the drain.
Very true, ma'am. Yes. Thank you very much.
Right. So here what we have to understand is parental role is very, very important to understand how they are become the more guiding their children and promoting their career choice with the stand-alone not the stand-alone approach, but it's ultimately a team approach what we really want being a family. Absolutely perfect. Any more question? So, Sandeep, we can conclude because it's already 9:40.
One thing, observation I would like to make before ending is we have made this 12th standard or some cutoff point where we have to take a final decision about life. And that is what we are going to be hold on to the whole life. This thought process as a society, as children's parents and children, they have to change. Because your decision whether it is successful or won't be successful is a series of steps from right now till he is maybe 30, 35 in his career. And a positive mindset and using life skill at each challenge will help you navigate this journey. So no matter what career you are going to take, there will always be challenges. There will always be struggles. There will always be failures. How you navigate with life skills is important. And if we can teach life skills early to our children, such problems would be less. A self-aware child, a child capable of coping with his own emotions, a child who can navigate interpersonal relationships will be able to use his thinking skills properly and with the help of family take better decisions for himself. That is what we'll say. So life skills would be an early prescription for all children. Let us start early instead of waiting for a problem to occur. It was a wonderful session hosted by Dr. Samisha sir and all our wonderful panelists. And it was, we expected to cover 2 cases, but because of the thoroughness and the points which were taken, we have decided that today only 1 case will be taken and we'll be continuing the second part, the next session.
Sandeep, just to interrupt you, there's a question here. So with 12th, I gave NEET yesterday. The result was came and I'm taking Ayush courses. Is it good? So Divyanshi, if you have understood what is Ayush course, you have understood the depth of it, and you feel passionate about Ayush course, there's nothing wrong. But you first should get all the information. So talk to people who have done Ayush course before, go to the website, understand about Ayush course. You can also come to one of us like an adolescent expert, because now you have to make an informed choice. So if you're taking Ayush, you have to understand, why am I taking Ayush? What is in Ayush which attracts me? What is it which I look forward that if I take Ayush 5 years down the lane, 10 years down the lane, where do I see myself with this Ayush course? And if you are happy about it, you certainly should take the course. But you don't take it without proper information. So you must get the proper information, take enough professional experience. Your ma'am is Ayurvedic, very good. So Ayurvedic course, yes, but you have to really like Ayurveda, and you have to really see that this is going to be my career. And then if you have enough information and you're passionate about it, yes, do go ahead.
So now it's a time to understand that no career is wrong until and otherwise you like it. अगर you are not like the even medical is also the worst part to take, what madam has said, because it is a very long journey. So if you not like and compulsorily going into the medical, it is a really you have to think twice, and that is a really parents also understand that they should not force that 15 years they have to spend with such thinking I have not want to go but I have to do this thing. That should be not happen. Next, just before we continue our discussion, next session will be on the 7th of the August, first Friday of the August, that is the 7th. So everybody please be ready with our next case about the body image issue. Yes, we can continue. Any panelists want to give any comment related to topic? Any panelists? Dr. Amruta, Dr. Sadhwani, Dr. Srikrishna, Dr. Kashmiri.
I think they all have spoken so well, and they've already given the excellent comments as panelists. So, yeah.
It was a great learning for all of us. Thank you all, the panelists, Samir Shah sir, and as always, our mentor and inspiration, Dr. Swati Bhave ma'am. With this, I conclude this session, and we'll be meeting 7th August, and all of us will be having lots of activities to inform also. So Samir sir will be telling what all happened in Aki week during that day. So see you all, and have a wonderful Aki week to all of you.
And Dr. Samir Shah has already announced the quiz, life
Yes.
skill quiz. So all of you who have kids of that age, or your friends or nephews and all, please share that link with them. It'll be a nice quiz which we'll be conducting.
Okay. Thank you.
Thank you.
We conclude.
Thank you, sir.